Meet James. James is a 35-year-old man that came to the emergency room. He had first and second degree burns all over his back with lots of areas of scalding and large blisters. Hi, I'm Dr. Brian. James had been drinking heavily the night before, and he got into a shower without paying attention to the water temperature, and he burned a large portion of his back with hot water. He said he was somewhat of a handyman, and he had changed the water temperature on his water heater to the highest setting because he loved to take really hot showers, and he'd done that for several years. And his main complaint when he came into the ER was the pain, but he underwent a standard physical exam and laboratory workup. On physical exam, he had extensive blistering and redness on his shoulders that went down the middle of his back almost to his waist, consistent with first and second degree burns. That was all expected. But what wasn't expected was his screening labs. When his screening labs came back, his potassium was low, his sodium was low, and his chloride was low. This type of lab abnormality is usually seen when someone vomits a lot or they're on certain drugs. But these labs didn't make any sense for simple burned skin. And it turned out James wasn't taking any of the drugs that might cause this. And after further questioning, he said he had recent bouts of vomiting. And specifically for the last 2 days, he had been vomiting a lot and as much as 6 to 8 times an hour. And then the story got a bit more puzzling because he had had episodes of vomiting off and on for years. And he thought they were associated with stressful life events. And he'd actually been hospitalized 5 previous times for intractable vomiting. On previous admissions, he had received a full round of laboratory tests, x-rays, CAT scans, ultrasounds, and all his workups had been negative. And when he was discharged, he was diagnosed with cyclic vomiting disorder. A cyclic vomiting disorder is a poorly understood condition where a patient vomits intermittently, maybe every few days or weeks or months, with no explanation at all. And they feel healthy between these bouts. Additional information that came out was that James was a recreational marijuana user, and he had been for many years. And especially over the last several years, he had started to use marijuana daily. Because with his diagnosis of cyclic vomiting syndrome, he knew that pot was well known for both an anti-vomiting and an anti-nausea effect. And the shower temperature, which was so high and got him to the emergency room in the first place, was also to manage his nausea. That was the reason he had turned his shower to maximum temperature, because a scalding hot shower helped him with the nausea, helped him with the vomiting, and he would often shower several times a day and sometimes several hours in a day. This last piece of information was the final piece of the puzzle. James didn't have cyclic vomiting syndrome, and his marijuana smoking wasn't helping his nausea and vomiting. It was actually the cause. James had classic cannabinoid hyperemesis syndrome, or CHS. Cannabinoid meaning all the substances derived from marijuana, including THC, and hyperemesis means excessive vomiting. So what is cannabinoid hyperemesis syndrome? What is CHS? Well, 50% of people in their lifetime use cannabis. And cannabinoid hyperemesis syndrome, or CHS, is a syndrome that's seen after many years of regular pot use. And it includes recurrent episodes of severe belly pain, severe nausea, and uncontrolled vomiting, plus a classic and characteristic pattern of compulsive hot water bathing. And that gives symptom relief. The symptom relief from bathing is really temperature dependent. The hotter the water, the more relief. Patients with CHS generally have a history, just like James, of multiple emergency room department visits and hospitalizations. They often receive extensive workups, imaging, invasive procedures, and they also often are diagnosed at the end with cyclic vomiting syndrome. We really don't understand well the causes of CHS. Possible reasons include that substances from cannabis act on special receptors. These receptors are known as CB1 and TRPV1. They're found on cells in the bowel and the stomach in the intestine. And the marijuana activates these receptors. CB1, if it's activated, prevents the stomach from emptying. That can cause nausea. And TRPV1 is a receptor that, if activated again by marijuana, can cause nausea, pain, and vomiting. Another purported reason for CHS is that really long-term cannabis use can begin to deposit substances from the cannabis into your fatty tissue, into the adipose. And over time, these accumulate more and more, and they're gradually metabolized and then released. And it's these breakdown products that might cause CHS. Another proposed mechanism is the THC. THC classically is thought to be an antiemetic or prevent vomiting, but that's really in the low doses. And in the United States, the concentration of THC in cannabis has been regularly and consistently rising. In 1996, it was 4%. In 2017, 17%. And now, in states that have legal dispensaries, a lot of the cannabis contains over 20% THC. These higher levels of THC may actually cause vomiting rather than prevent it. And finally, THC is actually known to narrow down the blood vessels to the bowel and the stomach, diverting blood away from the intestines. This definitely can cause both nausea, pain, and vomiting. So what is the treatment for CHS? From a medical standpoint, treatment is quite limited. Standard emergency room and hospital anti-nausea medications, they often just don't work very well. And pain control, even with opioids or narcotics, can be a real challenge. Oftentimes, volume replacement with IV fluid and electrolyte correction from the vomiting and just providing supportive care is about the only option. Currently, the only known effective treatment for CHS is to stop using cannabis. That's entirely curative. Cessation will result in the recovery within days to weeks. For some individuals, any volume of use of cannabis again can give recurrent symptoms. And for a select few, reducing the frequency can really help with the symptoms. But it can really vary between individuals. That's cannabis hyperemesis syndrome, or CHS. Thanks for watching, and please don't forget to hit subscribe.